We became increasingly concerned through last spring and the summer that the government was wreaking havoc on our healthcare system. They didn't appear to have a plan, and they didn't share with Albertans what they were doing. So if they did have a plan, they weren't sharing it with Albertans. They broke their promise, which was made in the election, to increase the number of long-term care beds, which are nursing homes or auxiliary hospitals where there are nurses on staff and there is medical care. Your drugs are covered. You're really in the healthcare system. You're in essentially a hospital situation. And they want to eliminate half of the current beds and replace them with designated assisted living. And what they mean is private care. They mean private clinics delivering services. So it became clear to us that the government did have an agenda. They were hiding it from people, and they were causing chaos in the healthcare system. It further became clear from talking to people and from the calls that we received and the emails and letters that Albertans were becoming quite concerned, and I think that's putting it mildly. And people started to send us documents in brown paper envelopes that talked a little bit about what the provincial government's plans actually were. And I'll just mention a couple of them. We heard from nursing students who had just finished their 4-year programs. They'd been encouraged by the provincial government to get into the field, and they had diligently performed their duties as students and had graduated only to be told that they would not be hired in this province, and so they are now faced with moving to another province or out of the country altogether if they want to work in their chosen profession. And it's very clear that the government has already eliminated a large number of nurses from the healthcare system. The model that Mr. Duckett proposes is to essentially shed a very large percentage of the registered nurses from the system and replace them with licensed practical nurses. But one of the main reasons why waiting times in emergency rooms have grown is not because they don't have the capacity to treat the patients when they arrive at the emergency room, but because they can't move them out of the beds in the emergency room because there are no acute care beds to move to. And that's one of the main reasons why we've seen a significant growth in waiting times in our emergency rooms. We heard from the local health councils, which in some centers were fairly vibrant and quite active, are appointed now by the government. There's no way to contact them, and their role has become increasingly obscure.